Hello, 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 everyone. I was told to wait a couple seconds before I did my intro because something got cut off before. Anyway, we're still figuring out I'm figuring out all the technical stuff of this. I am Dr. Garrett Smith, known as the nutrition detective around these here YouTube parts. And we have an exciting episode today. We're going to go over a testimonial from Emily Antiqua. She is someone I met through Twitter. And she was a Love Your Liver. She is a Love Your Liver program member, and now she started working with me directly doing the testing and consultation stuff. So we're going to go over her stuff just from the do-it-yourself Love Your Liver program, and then we're going to go over how she got sick, which for those of you following various health approaches, you'll recognize some of these. And then we'll go over her improvements since doing the Love Your Liver program. And then we're going to go into, I decided on a whim to go and connect cardiovascular disease, heart disease, strokes, heart attacks, all that stuff to toxic bile theory, copper toxicity, vitamin A toxicity, zinc deficiency, selenium deficiency, magnesium deficiency, potassium deficiency, basically all the major things that we fix that are common disease patterns in nearly everything out there today. I've done this for multiple disease conditions. Actually, I don't know if I did it very, very intensely for obesity yet, but I'm going to because I got kind of fired up on Twitter. Some of you will remember, I definitely did this in the inner circle inside the Nutrition Detective Network, the other live stream I do after this. But I predicted that the next wave of BS in medicine would be they would start claiming that bile acids in your blood are good and desirable. It's a disease state. It's called cholestasis. You make a very minimal amount of bile acids in the cells of your body, and they can put it into the blood. So you're as a correction to what I said before, I didn't know that there was those little teeny amount of bile acids made by the cells. So your blood will never technically be zero. Okay? I stand corrected. However, if your liver or your bile ducts or your gut or your stomach are putting bile acids into your blood through the process called cholestasis, this is a disease state. This is unhealthy. But now, what they're going to do is so everybody's sick, right? Basically, everybody's sick. And what they're going to do to gaslight everybody in the medical research world is they're going to say, well, people with more of this bile acid or less of this bile acid either get this disease more or get this disease less. You're not supposed to have significant amounts of bile in your blood at all. So, of course, they're going to be able to say, well, these people have this disease more than these people, because what do we talk about here? What causes your particular disease presentation, combinations of disease and all that stuff, is by the recipe of the toxic bile in your blood. You're going to see this today. We're going to go over it in multiple papers where they're specifically saying that more of this bile acid is bad and less of this bile acid is good, or what, they're going to say it. They're going to say the bile acid recipe increases the risk for this disease and decreases the risk for this disease. And then it's going to be the amount of that bile acid recipe, right? What you cook and how much you make of it is what comes out, right? So you put in a certain amount of ingredients, you get certain foods. And then if you double the recipe, you get more food. In this case, you would get more disease if you put more of the bad ingredients in. It's as simple as that. We're going to go over copper toxicity and vitamin A toxicity and heart disease, and we're going to go over all those deficiencies. Okay, so let's get into Emily's testimonial story. She posted this publicly on her Substack. So this is not information she is trying to hide from anyone. So Joe, can we go to that screen now? I'm just going to read what she wrote. Okay. So here we go. Joe, you ready for that share? Do I need to share it again? Let me share it again. I think I have to share it again because we lose all of this. There we go. Yeah, Joe and I were talking about we may have to get like a little earbud, a wired earbud, so I can hear him, so he can be like, "Hey, you're messing up." Anyway, here we go. So this is Emily's Substack right here, and this is her first part of it. How I got here. Why did I even get so sick? Okay. The title, Unhealthy Environment, Unhealthy Kid. These are her words. I grew up in an unstable home with a single mom. She did her best, but most of my childhood diet was Annie's white cheddar mac and cheese packets cooked in the microwave and the red Sour Punch straws. Oh, and Chick-fil-A. This was Northern Florida, after all. I was the sick one in the family. I had recurrent strep throat, and I got my tonsils removed when I was 4. I remember it vividly. I didn't heal right and suffered major blood loss. My mom being a nurse, I was, of course, fully vaccinated. This didn't make me any healthier. Oh, man. As a kid, I suffered from asthma, allergies, anxiety, depression, chronic colds/sinus infections, and at the onset of puberty, acne. My mom never understood why I had so many health problems, but looking back, it's pretty obvious. My diet was trash. I had an unhappy home life, and I was pumped up on Motrin and allergy meds at all times. And there's a picture. At age 7, circa 2008, notice the bags under her eyes. Next section, Retin-A, birth control, antidepressants. This is a common presentation of people, just so you know. When I hit puberty, I started getting bad acne, mostly on my cheeks and forehead. Instead of taking diet and lifestyle factors into account, doctors put me on various topical treatments, including Retin-A. That is all trans retinoic acid. Your body takes some of the vitamin A you eat and turns it directly into all trans retinoic acid. When you look in the research and you see them say just retinoic acid, they're referring to this molecule. You can absorb it you can put it on topically. There was that study on veterans where they had the veterans put Retin-A on their skin, hoping it would prevent skin cancer, and they had to stop the study too early because too many of them were dying early, even though they'd already separated out the veterans who they expected to potentially die early. Just to show you how toxic Retin-A is. Tretinoin. I saw an ad on Instagram for tretinoin, and they're trying to get this stuff over the counter to you people. They want you. That's what they want. That's their goal. So anyway, let's continue. Including Retin-A, none of which really helped. Soon after, when I was 14, they put me on hormonal birth control to get rid of the acne. This works by shutting down the body's own sex hormone production and flooding it with exogenous artificial hormones. This is a very effective Band-Aid approach, but it's causing severe damage to the entire body long term, particularly the liver. It was also around age 14 that my anxiety and depression got even worse. Coincidence? Birth control is known to affect mood greatly. It affects the liver. That's how it affects all of these things. In their infinite wisdom, my mom and my childhood psychiatrist put me on Zoloft, which I took all throughout high school until age 18. Honestly, I never noticed much of a difference when I stopped it, probably because the root cause of my depression remained constant without. I stayed on birth control for years. From when I was age 14 to age 21, I made the decision to come off because I realized that I didn't want to have to take a pill that made me infertile in order to have clear skin. Smart. While I didn't fully grasp at the time the damage that birth control had done to me, I knew that it was only masking a deeper problem. I would soon discover that not only is birth control like a Band-Aid, masking the deeper wound, it stifles it and causes it to fester and rot deeper and deeper. Yes. Getting healthy. When I was 20, 2 years ago, I decided I wanted to get off birth control finally. I was convinced by internet gurus that by adopting a low-carb, Weston A. Price Foundation diet. So we're going to go through, she's going through the typical spiral, if you want to call it. So for those of you out there listening, I want you to pay attention to these approaches that she tried. I tried this approach. You know, I actually spoke at a Weston A. Price convention on the toxicity of nightshades. You know, I went through all this. She's going to talk about Ray Peat in a little bit. I went through the Ray Peat phase. None of it fixed her and it made her worse. If you're out there trying to shoot nasty tweets at me and say about Weston Price and Ray Peat, go ahead. I'll still be here to fix you when you're broken and you finally realize that you made a mistake. Emily did. And then when you get to see her improvements after all these other nonsense things didn't work, reconsider. So anyway, let's go. That by adopting a low-carb /WAP diet, I could stop taking it without the hormonal rebound that many women experience. Promises. I began eating tons of eggs, cod liver oil, and she put bruh, yep, dairy, and even liver from the animals we butchered. Butchering her animals herself. Wouldn't this be the healthiest liver you could ever get? Noticing a pattern here. She's noticing the high vitamin A patterning. And there's copper and excess calcium and eating vitamin D in the dairy and all that stuff. At the time, I was living on a homestead with plentiful access to these foods on a daily basis. Shortly after, I went through a really traumatizing event and developed a bit of an eating disorder to cope. I became even more serious about my diet. She became cleaner. Even though I noticed no improvements, I truly just blindly followed the internet. I lost about 10 pounds, which, while not a dramatic weight loss, probably helped push my liver to max capacity of vitamin A. At my lowest weight, I was 135 pounds, just shy of 5'11" tall. Wow, you were tall. I got to talk to Emily the other day at her consult. And she says, here you can already tell I look dead in the eyes. This is when I first noticed the signs of vitamin A toxicity. That's the VA. That's how we write it. The little V, big A. I had been eating super high fat, high vitamin A, basically zero fiber for about 6 months. 6 months. Well, she already had a history of birth control. That sets you up. That's the start of the liver injury. Okay. I mean, the food is, her diet was also part of it. But anyway, none of this is necessarily her fault. She's a young woman trusting the internet. Okay. This is important. I got all these little bumps all over my body like keratosis pilaris, but not just on my arms. Aside, keratosis pilaris all over PubMed. Everybody says it's a vitamin A deficiency. It's a vitamin A deficiency. It's a vitamin A deficiency. It's not a vitamin A deficiency. It's vitamin A toxicity. And we fix it all the time by having people avoid it. Okay. Serum retinol, blood vitamin A, when they say, oh, all these diseases are related to low blood vitamin A, it doesn't mean anything. Watch when she goes low vitamin A and how many of these things fix themselves, okay? I started getting dizzy and tired all the time. My mood was horrible, and I truly felt like I was going to die, a sense of impending doom. My period hadn't come back after stopping birth control. I felt super hungry all the time, but I wouldn't let myself eat carbs. I distinctly remember being ravenous one night and creeping into the kitchen only to settle for an entire chicken breast. LMAO. Low carb, WAPFI, high vitamin A approach isn't fixing it. Interesting. It didn't fix me either. Things continue to escalate, but I didn't make the connection with my diet. I actually believed the internet that this was healthy. I went to the doctor to get my hormones checked because my period hadn't come back. They ran a standard blood panel and my cholesterol came back at over 350. Oh, and all my hormones were near zero. Continuing, further missteps. This might sound like some of the, I don't know, the carnivore type people progression you see on the internet. Let's go. So clearly something was wrong. I felt like death the way I was eating. In spring 2022, I discovered repeat. If you're not familiar, I recommend watching the Energy Balance podcast to get a grasp on the repeat diet. Spoiler, it is absolute trash. Basically, I was convinced that all my woes were due to a simple lack of carbs in my diet. So I added carbs back in, but didn't really change anything else besides cutting out the cod liver oil. I was still eating super high vitamin A, this time with carbs. It didn't help at all. The only thing that changed was I started rapidly gaining weight. How many of you out there got to go through the fattening of repeat? The absolute fattening of it. Fattest I've ever been was on repeat. The idea that they tell you you're healing by adding this body fat, you're not. You're just getting fat because you're getting toxic. Okay? The thing carbs did help was getting my hormones to start coming back online. This can happen, yes. Unfortunately, this wasn't a positive development as the excess vitamin A and copper in my body made my hormones go crazy and wreak all sorts of havoc. I started getting hormonal acne again, but that wasn't all. Although I'm a natural strawberry blonde and had always had light body hair, I started getting weirdly hairy and I had to shave my legs way more often. I started getting body odor in my armpits, which I never had before. My hair started falling out in clumps. That was the worst for me, as my long hair was my favorite thing about myself. Okay, so this was her hair before repeat. Next section. I've tried everything. As a, quote, petard, as I lovingly refer to as followers, sarcasm, I was only making myself worse. I was still eating all the foods rich in vitamin A that were hurting me. My condition continued to devolve over the next year or so. I want to emphasize here that repeaters love vitamin A. They eat tons of high vitamin A foods, and they even advocate vitamin A supplements. Some of them do. Carrot salad. Oh my, whoa. Anyway, they're huge on vitamin A. So she went from WAP, Weston A. Price, high vitamin A, to repeat, high vitamin A. Low carb, almost no carbs, high carb. She's noticed that the continuing factor that made her worse was vitamin A, and including the copper, and the birth control pills just set her up for all of it. Okay. I really felt like I had tried everything. I spent probably thousands of dollars on various supplements and health foods. None of them made any impact whatsoever, except to probably burden my liver even more. Yes. I was scouring the internet basically 24/7 trying to find something, anything to help me. I thought I had PCOS because of my hormonal symptoms, but I didn't have high testosterone on a blood test, so that made no sense. I was truly at a loss. A quack naturopath who I saw at the behest of my baffled mother gave me two $250 iron infusions. Not only did these not raise my low ferritin, they triggered some type of intense candida overgrowth, resulting in dandruff, a crazy rash that lasted for months, and IBS symptoms. I swear most doctors, naturopaths included, are hurting far more people than they help. I'm trying to change that. Eventually, in October 2022, I was so despaired that I attempted suicide. Clearly, that didn't work by the grace of God, but I was absolutely out of hope. I buzzed my hair off because it was too painful to see all the hair falling out every time I took a shower. I started wearing beanies and baggy clothes because I was terrified of people seeing what was happening to me. At this point, I kind of detached from myself. I accepted that this was happening and I had to live my life regardless. I was able to stop feeling so self-conscious and just exist in this state. Still, I felt like a disgusting monster. By the time I had deduced that the problem, whatever it was, centered around my liver, I did upwards of 17 liver flushes, which are basically forceful bile dumps. None of it helped. All the bitter liver-supportive herbs did nothing. Bitters are toxic. We know this now, and she knows it now. I was so angry because it seemed like everyone on the internet had found their cure in some diet herb or tincture, but none of it ever worked for me. Okay, here's a key thing for you all to remember. People love to give testimonials about short-term effects. We talk about the duration paradox here all the time. The duration paradox is something helps short-term, but it ruins things long-term. They show you cell studies on PubMed that show something helps in cells like retinoic acid, vitamin A. And long-term, we know that retinoic acid, retin A, Accutane, all this stuff is some of the most toxic medications you could ever take. Caffeine helps you with energy in the beginning and then makes you tired and more tired and more tired and more tired as you use it more and your use goes up. This is a common thing. Okay. Everybody loves to put their short-term effects on the internet. You know what you should ask these people is, say, tell me when your 3-year follow-up is still going. Tell me if you're still taking this supplement. Tell me if you're better. Or are you back to where you were before or worse? Most of them are probably worse. Short-term, like I've been taking this a week and I feel amazing. Waste of print. It's a waste of time and energy to read that crap. If that's all you wanted was short-term, I mean, you just go take heavy dose pain medications. They'll help you short-term. They'll ruin your health, right? This is, I mean, you can take, as she did, you could take birth control for acne and ruin your liver. The biggest thing that ruins women, in my experience, is birth control. So, and what does birth control do in the research? I've shown this multiple times. It raises vitamin A in the blood. It raises copper in the blood. Shouldn't protocol people and WAP people and repeaters be super happy about this and think that birth control is therefore super healthy? I mean, it's raising the things they want raised, and it's ruining lives. Continuing. The end of the beginning. June 2023. I had been at this for almost a year and a half on the, quote, cure carousel, trying everything and getting nowhere. I was at an all-time low. It was at this point that I finally heard someone mention vitamin A toxicity. Well, thank you for doing that, anonymous person out on the internet. Although incredulous, I gave it a fair shake. Immediately, I realized that there was something to this whole vitamin A thing. All my symptoms matched up. In my next post, I will go further into detail about my symptoms and how they've improved after 3 months on low vitamin A. If you've made it this far, thank you for reading, and please feel free to comment or tweet me at Mishfish on Twitter. Okay, so now we're going into the 3-month update. I know this is taking a while, but this is really important. This is how many people out there went through a similar thing. Okay, so here we have Emily's 3-month update. So it's now been a little over 3 months since I cut down vitamin A. I began on June 11th, 2023, and since then I've experimented and tried various things, but have generally kept vitamin A to a minimum. After a year and a half of worsening health issues, scrambling after solutions that led nowhere, this has been a godsend and the only approach to bear any fruit. All of my information and guidance has come from Dr. Garrett Smith and his Love Your Liver program. I personally spend a lot of time researching and putting the pieces together myself, but most of my understanding has been built on the foundation of Dr. Smith's work. I am a client of his, and I work to heal my toxicities and deficiencies under his supervision. I want to add something here that Emily is, when Emily says she was all over the internet doing research, the people who do really well on the Love Your Liver program are voracious consumers of information. What I mean by that is they want to learn. They want to know the whys. They want to fix themselves, and they want these answers to make sense. Now, one of the biggest compliments I get on this work is people saying that the stuff I tell them, when they start to put it together and understand it, and they spend enough time with it, and they see enough people inside the Love Your Liver program, making comments, and it's very much like the way a social network is supposed to be, of people helping each other. It all starts to make sense. Their reactions in the past make sense. They're like, oh, I remember I took this thing that Dr. Smith says is toxic, and I felt better for a little while, and then it all fell apart. And then they understand the bile dump thing. Like when they dump toxic bile and it gets into their system and they feel bad, they have their symptoms show up. And then they can look at what they did and they can say, oh, I did this that caused it. Or they even read like my space weather article, and they have a space weather app on their phone, and they see, oh my gosh, a solar flare just happened. And then at some point later, I feel bad, and they start noticing a pattern with that. Can we change that? No, but at least you're not going crazy, not knowing why you feel terrible all of a sudden. All of a sudden, for no reason, you don't feel good. You can go and sometimes look at your app and start correlating your symptoms with space weather. And if you don't know that space weather affects human health, you just haven't seen it in the research yet, because it's totally legit. Okay, this is why like everybody who works in a hospital knows that when there's full moons, the hospital goes crazy with people coming in. It's legit. Like whatever you believe about space, that doesn't matter. Stuff that's going on up there is affecting us down here. Okay, so let's go. When I initially cut vitamin E in June, I got a, quote, detox flu almost right away. I'm talking tons of stuff coming out of my nose, crazy headache, liver pain, coughing. It was obvious that something big was shifting in my body. I could feel my liver working overtime. It was exciting to feel something change. So she had this, some people call it the detox setback. Some people she's calling it a detox flu. What was actually likely going on? When she cut, okay, so vitamin A, I have the research, basically slows down your liver's production and excretion of bile. So it doesn't go where it's supposed to. It's either getting stored in your liver, which is why fatty liver is yellow. Vitamin A, biggest color of vitamin A is yellow. Vitamin A is stored in the fat. Fatty liver is yellow. Okay. So then the body actually starts putting the bile it starts making more bile and pushing it out, because it wants to get rid of this vitamin A, this toxicity. the person is still leaking bile into their bloodstream. So it's like the body's saying, we got to get rid of this toxic bile. We got to dump it. It starts to make it faster and make more of it, but it's still leaking into the system. This is part of the process. Now, I don't necessarily encourage people to push this hard, but all she did was she took the vitamin A out of her diet. That's all she did. Okay? And then her body starts just dumping garbage because that's what happens. It wasn't a vitamin A deficiency in a week, you know? Here we go. In the past 3 months, the following symptoms have all but disappeared. So pay attention, Weston Pricers and Ray Peters and all you high vitamin A people. 3 months. Now, this is not always the way it is. This is a young woman. The younger people are, the faster they recover. Okay? Dandruff, yellow skin, digestive problems / IBS, cracked lips, eczema on my right hand, present for 6 years, keratosis pilaris, dry alligator skin on my shins. And she says, this comes back if I have butter or dairy. Suicidal thoughts / self-harm, struggled with this since age 12. Anhedonia / hopelessness. She says, I still slip into this when I'm really feeling toxic, but it never escalates like it used to. Low ferritin. I had chronically low ferritin that even iron infusions couldn't really raise. It was around 15 to 25. After 2 months on the program, it was 41. I donate blood every 3 months too. Tinnitus. Continuing, these issues have improved but not resolved. Remember, we're only 3 months in, and I don't promise overnight results. That's not what we're doing here. We're fixing deeper issues. Anything that's overnight results is fake. It's either you fixed a true nutrient deficiency like zinc. If you take zinc or magnesium and all of a sudden you feel better, those are true nutrient deficiencies that if you fix them, you can feel better. But otherwise, when we are fixing deep deficiencies and deep toxicities, it's not overnight. I never promised overnight. People here know that this is a marathon, not a sprint. But she's 3 months in and she's seen this. So if you're out there hearing this and you have these symptoms, we're here anytime. So here we go. These issues have improved but not resolved. Dry, flaky skin on face. Acne. I have helped it a lot by taking diatomaceous earth, which I theorize binds to copper in the gut. More on that in the future. I haven't looked into that too much, but Emily, if you want to send me a DM and let me know what you think on that, that would be cool. I didn't see much changes when I used diatomaceous earth in practice. So anyway, menstrual cycle / hormones. Slightly shorter follicular phase, better signs of ovulation, but luteal phase is still only 3 to 5 days when it should be 14. This is indicative of low progesterone and copper toxicity, less large blood clots during her period. Hair growth. Although I still shed a lot, new hairs are growing in everywhere on my head. Since hair grows in cycles, I think I'll start to see less shedding within 3 months. Liver pain / twinges. We see people's liver, they have liver pains or gallbladder pains. They get better all the time. Gosh, what do you think we're fixing? Wound healing time. Ovary pains around ovulation. I am confirmed to have a small cyst on my right ovary as of 6 months ago via sonography. This isn't a huge concern. It's due to anovulation and should go away on its own once I get my hormones regulated. However, during times in my cycle where estrogen peaks, I sometimes feel a small painful twinge where it sits on my ovary. Dental weakness / chipping. I was blessed with great teeth, but when I was super sick, my 2 front teeth both chipped a tiny bit at the bottom. No one notices except me, but it was so upsetting that things got that bad. I have not had any more chipping, but my teeth are still not as strong as they were before. This will improve. Okay, not yet improved. Progesterone levels are still basically 0. I expect this to improve over time. I think my liver is still in bad shape, so my body is protecting itself and will not secrete hormones that my liver can't handle. However, this means I suffer from imbalanced hormones for now. But okay, so she did the labs. She did the hormone labs. Not seeing a lot of change on the hormone labs, but less ovary pains around ovulation. Remember, these are the things that she said they're not gone yet, but they're improving, right? So we see that her ovary pains around ovulation, that's improving, okay? She's seeing improvements around her menstrual cycle and and signs of hormones, okay? Were there any things up here? No. But I mean, look at this. Look at dandruff, basically a skin problem. Yellow skin, bile, vitamin A, toxicity in the system. Cracked lips, eczema, keratosis pilaris, dry alligator skins. Okay, so, and then the worst of the mental stuff, right? Anhedonia, suicidal thoughts, hopelessness, like the worst of these things. So, skin, as we talk about in the detox priority order, the skin is overflow when the liver can't get rid of stuff and when the kidneys can't get rid of enough stuff. Then it starts pushing out through your skin, and you're pushing out toxic bile with all this toxic, nasty stuff in it out of your skin, and it's irritating your skin. It's kind of like chemically burning your skin from the inside out. So as she's becoming less toxic, her bile is not only becoming less toxic, but she's not pushing as much of it into her bloodstream. And so she's seeing less skin stuff. And the lowered toxicity of the bile in the blood is why her mental symptoms are less. I went over, if you guys haven't seen that special episode I did with Kelsey on ivermectin, I was going over, I think I covered a specific study on serum bile acids in schizophrenia. And yes, I've had clients before who were having dissociative episodes. They were like, dissociating. They were seeing themselves from outside, and they got better. Okay. This mental stuff you're having is toxicity. And what do they want to do? They want to legalize hallucinogens, and they want you to take ivermectin, which is associated with psychosis. Oh, and you could take mefloquine and hydroxychloroquine, which are associated with psychosis. Oh, and you could do all these other antiparasitics that are associated with psychosis. Oh, and now I just found out, some of these medicinal mushrooms. Oh, you can hallucinate, not just hallucinogenic mushrooms, but some of the other healthy mushrooms. You can actually hallucinate with them. This is new. This was new to me, but lion's mane apparently has hallucinogenic properties if you take enough of it. So they want you to do lots of things that negatively affect up there. So let's keep going down. So, but the progesterone, you can see that the hormone presentation, even the acne, the hormone presentation is improving. Okay. Cracked heels / calluses on feet. That takes a while. We've seen that. She put here, being a heckin' chonker. She says, I gained like 35, 40 pounds since getting really sick. Thank God I'm 5'10" and pretty curvy, so I carry it decently. Thankfully, I'm starting to get that under control, but I think my weight will be one of the last things to improve. I know my fat cells are full of toxicity. I was really skinny before this started, so I had to create space for the poison, LOL. This is true. I'm just going to tell you guys out there who are following the program, or who are working with me, or who are doing kind of a vitamin A detox thing on your own. There's one of two things is going to happen with the body fat. One, your body may just automatically lose it as you get healthier. Consider yourself lucky. If that just happens, that happens. Now, if you're one of the people like, let's say myself, where when I was growing up, I was like the kid who would get 2 or 3 full plates of food, and I was into the bodybuilding mentality and doing the half gallon of milk to gain 15 pounds over a summer for baseball to bulk up. Like, okay, if you've trained yourself to just eat too much food, and you've bought into the idea that calories in, calories out is complete BS, that you don't ever have to count what you eat, let me give you a little advice. If you eat too much damn food, you're going to carry more damn weight. Okay? It is sometimes that simple. So I went through detox for like 3.5 years, and I didn't lose weight. You can see it in my old videos. And then I finally said, maybe I just eat too much. And I started counting my calories, just seeing what I was at. And I was like, oh, I'm eating too much. I'm just eating too much food. So you know what? I fixed my intake of too much food, and the weight just fell off. And funny thing, now that I'm more detoxed, And if you haven't seen my labs video where I go over my testosterone, I've got good testosterone for a great testosterone for a 47-year-old guy. And now I'm on kind of a new weight training program. And the weight is coming off. I think I'm leaner than I've ever been at a higher muscle mass than I've been in the past. So things are working pretty good. Don't ever throw out the whole calories in, calories out. Don't live by it, but don't throw it away. Okay? If you're just eating too much, you're going to have a hell of a time losing weight. Now, if you're underweight and you're just shoving calories in all day, like way more than you should have to, your problem's in your liver. And let me give you guys a little advice. You underweight people. If you're shoving calories in, calories, and you're not gaining weight from doing that, like if you there's a certain amount that you have to put in to maintain. But if you're trying to gain weight and you're just shoving in more and more calories and it's not working, don't keep doing it. All you're doing is putting more strain on your liver. Okay? People we see in the Love Your Liver program, as they get their liver healthier, eventually they're able to their calories can normalize, and then they even start gaining some good weight. Okay? But this Ray Peat thing, people getting just horribly fat on Ray Peat, or even Weston Price. I mean, you go to those Weston Price meetings and you either see people, you're going to see two types of people, two types of liver messed up people at Weston Price meetings. You're going to see they're going to be significantly overweight or they're going to be significantly underweight. And the only people you see who are normal weight are still like in their 20s or 30s because they haven't gotten effed up yet. And Ray Peters just... We can go over lab results. I'll just cover this real quick. I'm not going to go over my lab ranges here because you give people a little bit of rope and then they go and hang themselves. And I'm not doing that to you people. I care too much about you people to give you information that you can ruin yourselves with. Vitamin A. Most people come to me with their vitamin A in their 30s and 40s, which is normal. And so I want you to look at her vitamin A. Here's the range. That's the range that LabCorp gives you. Okay? She's totally within normal. Some doctors out there, like especially nutritional doctors, functional doctors, naturopathic doctors, will be like, oh, your vitamin A is almost low. We obviously have to give it to you. And this is a woman who was doing all the liver and dairy and all, I don't know if she was doing the carrot salad or whatever nonsense otherwise, but you can be completely, this is in the research, you can be completely vitamin A toxic in your liver while your blood test could even be low. Most people who come to me are in the 30s and 40s. I help them. So if you think that you got a blood test and it's normal, and so you obviously don't have vitamin A toxicity, and so you just throw out everything I say, come back when you figure out that you were wrong. Copper is higher than I like it. Zinc is lower than I like it. Ferritin, we're not trying to boost ferritin here, but when you have somebody who has chronically low ferritin and they're sick, their ferritin's probably going to come up. I have a whole live stream on ferritin. Okay. Her ferritin was probably low because she wasn't pumping out much bile into where it's supposed to go. She wasn't making much because she was so vitamin A toxic. Like I told you, she took the vitamin A out. She starts making more bile. Your body gets rid of ferritin in the bile. She's leaking a little more bile. Remember how she said she didn't feel good? I said she's leaking more bile because she's making more bile. Where do we store ferritin? In the liver. How do we get rid of ferritin? Through the bile. We see ferritin go up in the blood. Is this part of the repair process? It is part of the repair process. Most people out there do not have the bandwidth, including medical researchers and doctors. They don't have the bandwidth to figure out that the recovery of health has different stages. If we are seeing somebody improve, you see all those symptoms she improved over 3 months, right? How could anybody, and I've probably got her on less supplements than she was on before, how could anybody look at that and be like, things are getting worse? Or they're looking at it and going, obviously we have to give you progesterone to raise your progesterone. No, she's doing just fine. Like, even, I'll be honest, even if we did liver enzymes here, and let's say she started the program and her liver enzymes were totally normal, and we see all these improvements, and I saw her liver enzymes go up a little bit, maybe even out of the range a little bit, if that was what happened. We didn't do liver enzymes on her. But even if I saw that, I wouldn't be worried, because every single other sign in her health is improving. Okay? I'll read her statement here. Copper is higher than where Dr. Smith wants it. You want to switch over? There we go. Copper is higher than where Dr. Smith wants it, and without enough zinc to counterbalance it, a copper toxic state as a result. I guess 7 years of birth control will do that to you. Vitamin A is in the normal range, quote, normal, right? But those parameters are based off of a sick population. I know from symptoms that I have way too much of it. I expect that it will probably spike next time I test as my liver lets go of more. Ferritin is good. This was an exciting and unexpected result. Overall, I am so happy with my progress thus far, even though I haven't made a ton of difference in my major problems. What major? I mean, some of those skin issues. I mean, okay, everybody. Okay, let me back up. Everybody's major problems that they are concerned with are different. You know, suicidal thoughts, hopelessness, anhedonia. I would kind of personally, looking at it from the outside, I would kind of say that those were the biggest things, and those are gone. And then we got the eczema and all the other skin stuff. But, you know, everybody has, this is why, for those of you out there who want to be practitioners, or if you go to a practitioner and they don't do this, if you want to be a practitioner, I was taught this. The first thing you ask people is, what are your biggest issues that you want to fix? Okay. You as a practitioner might have all sorts of other diagnoses, right? Oh, the menstrual cycle was her major one. Okay. So she said, sorry, don't worry about apologizing. But I mean, that's an important thing, right? But as you can, obviously mental state is very related to hormonal stuff. So we could see it as, if the mental state is improving, the hormones underneath it are likely improving. We just haven't made as big of an impact. And also, Emily just started working with me in the testing and consultation where we were doing this testing. So that test was not, that was fairly recent. That was not before she did all of this. Okay. So, you know, and so we're working on zinc and all the other stuff that we're going to talk about. Same things we're going to talk about with the heart disease coming up, even though Emily wasn't presenting with heart conditions. It's the same patterns everywhere, folks. Okay. So, but anyway, so ask people what their major concerns are. What do they want to fix? Because that's why they're coming to you as a practitioner. Like, I might have seen it, I saw it differently. I might have been like, well, the mental state stuff was pretty important. You know, if you're not going to be around here anymore because you do something to yourself, that's kind of important. That's like a real priority. That's my thoughts on it. Emily said the menstrual stuff was her biggest concern. So try to be, you know, you're trying to, as a practitioner, you want to help people with what they want help with. If you're looking at their labs and you're a functional practitioner, which I threw all of that functional medicine stuff in the garbage where it belongs, because you're basically looking at labs. Oh, as Emily says, yeah, I feel a million times better. Thanks to Dr. Smith. Yes. So that's what we're trying to do. But anyway, if you do functional medicine out there and you're looking at labs and you're almost disregarding the person in front of you just to treat their labs, to make their labs look prettier. I used to do this. I learned how to do it, and I'd make people's labs look better with all sorts of ungodly expensive supplements, and their labs looked better. But the person in front of me said, I don't feel any different. Or maybe they even said, I feel worse. Do I have to take 12 pills 3 times a day, Dr. Smith? Like, my buddy just brought me over a functional medicine practitioner's list of Zymogen supplements. It was 2 pages. And Zymogen supplements are big combination supplements. So this person must have been taking 80 different ingredients. And I think he told me that this person was saying they were feeling worse. You too can pay hundreds of dollars to feel worse and be inconvenienced. Anyway, so let's finish up Emily's thing here. Overall, I am so happy with my progress thus far. Even though I haven't made a ton of difference in my major problems, I have seen the back of various smaller issues, and that's enough to tell me that I am on the right path. The best part is that it's super easy to stick to this. I would have no complaints eating this way for the rest of my life. I'm super excited to see where I'm at in another 3 months for my 6-month update. Thanks to Dr. Smith and everyone in the Love Your Liver Detox community. Okay, so I know that took a long time. That took almost an hour. Just so you guys know, be careful of sending super chats yet because I got so much stuff to go through now. So now we're going to get into heart disease, cardiovascular disease, heart attacks, strokes, all that stuff in terms of a framework of toxic bile theory. Now, if you want the background on toxic bile theory, go to live stream number 71 on this channel, and that'll talk about the basics of toxic bile theory. So what are we working on here? What do I fix on a daily basis? What do I try to fix in people? What is the whole basis of my health approach? We want to take less toxins in, known toxins, ones that are often thought to be good for you. Like we want less vitamin A coming in. We want less copper coming in. We don't use vitamin D rat poison supplements. If you didn't know they're rat poison, you can go look up Tera D3, TERA-D3, and D-Con. I love that name. D-Con. It's a con, folks. So we'd stop putting in these poisons. We don't put in tons of manganese. We don't take chromium, which is a non-essential toxic mineral. We don't do these things that are known poisons, and then we avoid all the basic stuff. I mean, you want to avoid glyphosate. You want to avoid plastics as much as you can, and microplastics and all. So we want things to be clean. That helps your own liver. That helps your own liver to fix itself. And then we put in the right nutrients that the body needs to run all these things, like zinc, like magnesium, like potassium, like selenium, like the right amount of molybdenum. We make sure you get enough of the right type. We make sure each person, for their own needs and their own tolerances, gets the right amount and the right types of soluble fiber. More is not necessarily better. Different people need different amounts at different times. And we do things for people who are pooping well enough. They can do things like charcoal to bind up, which we'll get to see. Charcoal can bind up bile. We get to see a paper about bile acid, things that sequester or grab onto bile acids and carry them out. There's a paper in here that showed benefits to that in cardiovascular disease. Imagine that. And you get enough protein. We're not an all protein diet. We're definitely not a high fat diet. We're definitely not a high fructose diet. But these things, nothing is off limit. Oh, Eve. Emily, please post your Substack link. If you can see on the well, actually, here, I'll put them up. I'll put them in the I'll put them in the chat. Let me go into the chat. Here's the how she got there link. And then here is the here is the 3-month update. Okay, yeah, there's those links. Okay. Let's get into heart disease. So yeah, no more, don't do any super chats. I think I have one from last week that I still need to get to. So hopefully we'll get to it today. If not, I mean, this is going to be a while. This is going to be okay. Yes, thank you. Joe has the one to go over, but let me get into okay. So here we go. Toxic bile theory. The idea behind toxic bile theory is that your liver stores toxins. If you still are stuck on the idea that the liver doesn't store or quote unquote accumulate, that's the word they use in the research, the liver accumulates toxins. It does. Anybody who tells you different is probably part of the reason you're still feeling sick. Your liver stores toxins. Your liver is a filter by definition. A filter is something that pulls something out of something else. That's the basic definition of a filter. So does your liver do that? Does your liver pull toxins out of your blood? Yes. So it is by definition a filter. Your liver is like a sewage treatment plant, a sewage processing plant. It is taking chemicals and turning them into other chemicals. Notice how I didn't say less damaging chemicals, because your liver can take certain chemicals and make them into less toxic chemicals, but it can also, there's a process called biotransformation or intoxication, where it takes certain chemicals and it makes them more toxic. And everybody's like, wait, why does it do this? And I go, I don't know. I'm not the grand designer. I didn't make it. I just watch it. Okay. And your liver is a toxin storage depot. It is. So are your kidneys. Kidneys store cadmium and lead and all sorts of things. Don't eat these things. Don't eat liver. Don't eat kidneys. Don't eat organ meats. Okay, so let's go into the first paper. So first we're going to go into toxic bile theory. I'm going to show you that more bile in the blood is associated with more heart disease. So what this means is if there's more bile in the blood, there's more of all the toxic things that your body gets rid of in the bile. Toxic metals. And everybody's like, you need to detox from your toxic metals. Well, how are those toxic metals getting into your blood? Via the bile leaking into your blood, because your body's trying to get rid of them into the bile. But if the bile leaks into your blood, you get toxic. You are self-toxifying all the time by leaking bile into your blood. We want to reduce that. Okay, so here we go. Heart and bile acids, clinical consequences of altered bile acid metabolism. Just going to hit the highlights here. Studies show that elevated serum bile acids are associated with cardiac dysfunction. Bile acids have been implicated in the formation of cirrhotic cardiomyopathy. That's heart muscle disease. Okay? Bile acids with a higher hydrophobicity, water phobicity, phobia, scared of, they are less water soluble. If you want to, I think that's, I'm pretty sure it means solubility here, have an increased dysfunctional effect. So, they're saying certain bile acids are worse than others. Gosh, isn't that the bile acid recipe? I don't think there was, I did do one little thing here. So here we have elevated motherly during pregnancy, elevated maternal serum bile acids in intrahepatic cholestasis of pregnancy. That's where the bile leaks straight from the liver into the blood. A disorder which causes an impaired feto-maternal bile acid gradient, have been associated with fatal fetal arrhythmias. Okay, I want you to understand the implication of that. Too much, okay, when women get pregnant, they start dumping crazy amounts of toxic bile into their system. This is why, if you were ever a woman and you felt terrible during pregnancy, it's because you're leaking bile into your blood. Now it has been accepted that subclinical, below the levels that they can detect on labs, subclinical intrahepatic cholestasis of pregnancy is considered absolutely normal and expected. That's how toxic and damaged everybody is, but especially the women who are getting pregnant. Probably because of so many histories of birth control, people. Stop taking the pharmaceutical poison called birth control. Babies have died of heart problems because of too much bile in the mother's blood. Okay? I don't think there was anything else here. So let's go into it. Here. Bile acid excess induces cardiomyopathy, heart muscle disease, and metabolic dysfunctions in the heart. Oh, wait, I forgot to put the link here. Wait, let me put the link. And some of you may look at these papers and you're going to be like, but they say that this bile acid is good for it. That's exactly what I'm saying. They're going to show that different recipes are related to different conditions. And before any of you go and start looking at UDCA in there and start thinking TUDCA's good and UDCA's good, I've been over UDCA toxicity multiple times in these live streams. Duration paradox. Can you use something short-term and help a condition while long-term it destroys it? Yeah, UDCA destroys your liver. But so what does conventional medicine do? They give it for conditions. Cardiac dysfunction in patients with liver cirrhosis is strongly associated with increased serum bile acid concentrations. Okay. Just finding a pattern here. You're not supposed to have a lot of bile in your blood. The more diseased your liver gets, the more bile you get in your blood. You can almost think of pregnancy as almost like a form of liver disease. You should see the labs on pregnant women. Their copper goes through the roof. Absolutely. They're just dumping copper out of their liver. My ex-wife hated being pregnant. I knew the whole time, especially now I look back, I'm like, she is so copper toxic. 13 years of birth control? 13 years. I mean, what does that do to a liver? Okay, bile acids induce arrhythmias in human atrial myocardium, the atrium of the heart muscle. Implications for altered serum bile acid composition in patients with atrial fibrillation. Taurocolic acid concentration dependently induced arrhythmias in atrial trabeculation. So I just want to hit on this. Well, let me go over this. Patients with atrial fibrillation had significantly decreased serum levels of ursodeoxycholic acid. Conjugates, things bound to ursodeoxycholic acid, TUDCA would be one of them, and increased levels of non-ursodeoxycholic acid bile acids. They just said the recipe. The recipe was different in patients with atrial fibrillation versus those who didn't have it. But here we go with taurine. People think that taurine is like always good. I'm going to tell you, taurine might help you feel better. Taurine might help you feel much worse. Taurocolic acid, the only way you make taurocolic acid is by getting taurine into the system. Taurocolic acid, the more taurocolic acid that was present, it induced arrhythmias. Okay? So this is where like glycine and taurine. Some people feel amazing on glycine. Some people glycine's a disaster. Some people feel amazing with more taurine. Some people taurine's a disaster. Taurine or glycine, adding more of them can change your bile recipe. They're just saying it right here. Conjugated means you could be binding taurine to it. You could be binding glycine to it. You could have UDCA. You could have TUDCA. TUDCA is just UDCA with a taurine bound to it. And as Hope's saying down there, taurine does not agree with her. There's tons of people that taurine doesn't agree with. Okay? So anyway, so that's the bile acid recipe, but more taurocolic acid in the blood, more arrhythmias. Let's keep going. Circulating primary bile acid is correlated with structural remodeling in atrial fibrillation. So these are some of the abbreviations. I just highlighted them. Okay. Paroxysmal supraventricular tachycardia. Wait, did I? Well, let me highlight it now. Conclusions: the higher circulating level of chenodeoxycholic acid in atrial fibrillation than in, what was PSVT? It was paroxysmal supraventricular tachycardia. Positive correlation of CDCA with left ventricular, left atrial low voltage area in atrial fibrillation, and incubation dose-dependent increase of mouse atrial myocyte apoptosis, cells destroying themselves, dying, indicated that chenodeoxycholic acid might play a significant role in the progress of structural remodeling of atrial fibrillation. Continuing. Bile acids regulate cardiovascular function. That doesn't mean it's a good thing. End-stage liver disease. I want you to understand, before we get to the intrahepatic cholestasis of pregnancy, look at the relatives here. end-stage liver disease, obstructive jaundice. So you're getting high bilirubin backing up into the blood, and intrahepatic cholestasis of pregnancy, which now has been said to be normal in pregnant women, normal, are prominent conditions in which elevated serum bile acids alter vascular dynamics. Okay, Joe, I'm going to put them. I don't know how many I missed here. Let me see. Going backwards through these links to put them in. I'll just put them all. I'll do better next time. Oh, come on. There we go. That one, and then I'll just, I know I did the first one. No, I already had highlighted that one. Okay, so continuing. Did I get anything on this one? Yeah, there we go. I just didn't highlight this. Here we go. Overview of bile acid signaling and perspective on the signal of ursodeoxycholic acid, the most hydrophilic bile acid in the heart. Elevated bile acids are associated with arrhythmias. So those of you out there with palpitations, elevated bile acids are associated with arrhythmias in adults and fetal heart, and altered ratios. Altered ratios. You mean like the recipe of the bile of primary and secondary bile acid are reported in chronic heart failure patients. Meanwhile, in patients with liver cirrhosis, cardiac dysfunction has been strongly linked to the increase in serum bile acid concentrations. And here they're going to give you a secondary, they're going to suggest you take a secondary bile acid, ursodeoxycholic acid, has been found to be beneficial in improving peripheral blood flow in chronic heart failure patients. Duration paradox, it will be a disaster. Secondary bile acids. UDCA is a secondary bile acid. Those are the most toxic. Don't do it. Did I put this one in there? I don't remember. Yeah, I did. There it is, 474. Relation between bile acids and myocardial heart muscle damage in obstructive jaundice. How do they find obstructive jaundice? They measure your bilirubin. If you have high bilirubin, you got cholestasis. You're leaking bile into your blood. Okay, so what did they do? Common bile duct was ligated. They basically tied off the common bile duct. So it guarantees cholestasis. Okay. Put this in here. They do this to study it. 1 to 2 weeks after the common bile duct was ligated and severed, damage was evidence in the mitochondria. Boy, everybody loves to talk about mitochondria. Damage was evident in the mitochondria within the myocardium, the heart muscle, and the serum total bile acids was significantly increased. Conclusion, an increase in endogenous, made within the body, endogenous bile acids is one causative factor of myocardial damage, heart damage, in obstructive jaundice. The bile acid is causing the problem. Now, don't forget, there's all the things that are in the bile. Don't forget that, because we'll get into copper and vitamin A, the things your body, the toxic things your body tries to excrete in the bile. And how when those are higher in the blood, probably they got there because of leaky bile. There's more problems too. This is a fun one. Oh wait, this is not supposed to be here. This is supposed to be in my vitamin A section. Anyway, let's just head right into the vitamin A stuff. Before I start on this, before I hit on retinol-binding protein, I want you to understand something about retinol-binding protein. Retinol-binding protein is a protective protein your body makes to bind to retinol, so it's not free retinol. Free retinol is the most damaging retinol that could be out there. I know Jack Cruz has been getting into free retinaldehyde. Free retinaldehyde is super toxic too. All the vitamin A is toxic. Your body makes things to bind to retinol, so it's not free. It's like protective. It's like an escort. It is not, as an escort is like a protective escort, I mean, like bodyguards. Okay? It is not delivering vitamin A around places, because what you're going to find is you're going to find that retinol binding protein, there's lots of studies saying retinol binding protein is damaging. It's inflammatory. So wait, you vitamin A lovers, it's either the very thing that you're saying the body makes to deliver the vitamin A to tissues is toxic itself, Or what other studies say is the amount of retinol-binding protein they can find in your system is another way of measuring how much vitamin A you have around, because your body wouldn't make retinol-binding protein if there was no retinol around, right? So the retinol's toxic. We know free retinol's toxic. And now they're saying retinol-binding protein is toxic too. I'm saying it's a protective protein. Your liver makes it to protect you. But they're saying it delivers it, and that the delivery guy is actually toxic to you as well. So we'll get into that. Okay. Homocysteine is a marker supposedly of inflammation, right? It's a bad thing. I have a whole video on this channel going over how vitamin A raises homocysteine, and the very things that they say you need to reduce homocysteine, folic acid and B12, are depleted by vitamin A. I have a whole video on this channel. Okay. So the risk association of plasma total homocysteine with acute myocardial infarction is modified by serum vitamin A. So let's just go into this. Plasma homocysteine was higher among participants in the upper versus lower vitamin A tertile. So they divided them into 3 groups by vitamin A levels. The highest vitamin A people had higher homocysteine. Oops. Now, wait, this is... Okay, here it was. I wanted this. I didn't finish my highlighting. The risk relationship between plasma total homocysteine and acute myocardial infarction was modified by serum concentrations of vitamin A in patients with suspected stable angina pectoris. Sorry, I didn't finish that part. What they were saying... Sorry, this is what I wanted. I didn't want this one. Can I take that off? Anyway, let's just go with this. When we stratified the population according to vitamin A tertiles, so the 3 divisions of people based on their vitamin A levels, plasma total homocysteine was associated with acute myocardial infarction only in the upper vitamin A tertile. Only the highest vitamin A people was it associated with heart attack when they had their plasma total homocysteine was associated with heart attack only when it was the highest vitamin A people. Okay. Part of me wants to get rid of this. How do I get rid of this? I don't know. There we go. Hey, oh no, get out of here. Okay. This is the gaslighting that they're going to do to you folks. Metabolism of vitamin A in the heart increases after a myocardial infarction. I remember finding this one a long time ago. Metabolism of vitamin A in the heart increases after a myocardial infarction. Okay. MI is myocardial infarction. That's heart attack, if you didn't know. 3H vitamin A. This is a marked vitamin A. So this is like an isotope. Radio-labeled vitamin A. 3H vitamin A was injected into 2 groups of rats, a heart attack group and a control group. So they're going to give some rats a heart attack. I wonder how they're going to do that. I didn't look to see how they were going to do it. So the greatest difference in vitamin A content was in the concentrations of the 3H labeled storage forms of vitamin A in the liver of myocardial infarction animals. Activity of bile salt dependent retinol ester hydrolase, an enzyme responsible for hydrolyzing vitamin A storage forms. So it's cutting the fatty acid ester off of it so it can send it into the bile. Okay, that's where it's going. The only way that these stored vitamin A forms are getting to the blood is through the bile. Okay, so this enzyme was cranking up. The activity was significantly increased in the liver. Weird that the ones that had the heart attack were dumping more vitamin A into the bile. Chicken or the egg, right? Specifically, during myocardial infarction, Okay, I want you to understand. We talk about stress causing bile dumping. Stress causes bile dumps. This is why you feel so bad when you get stressed. Stress causes bile dumping. What's in the bile again? Vitamin A from the storage in the liver. Specifically, during myocardial infarction, do you think that maybe when they gave these rats a heart attack, they're giving them a heart attack? Do you think that's stressful? Specifically, during myocardial infarction, increased amounts of vitamin A are mobilized. They're trying to make vitamin A good. They have to make vitamin A good, or else they'll lose their funding. Bill Gates won't fund them anymore. It's mobilized from the liver to the heart without changing plasma concentrations. Wait, so they just said you took vitamin A from the liver. It went in the blood to the heart, but the blood levels didn't change. Do you see why measuring blood levels of vitamin A is so stupid and fruitless? This is facilitated by an increase in the activity of an enzyme that hydrolyzes vitamin A storage forms. You know, they never thought to think that maybe the vitamin A being freed up in the bile when we're trying to kill these mice or rats actually caused the heart attack. Amazing, right? So now let me find my other. This is the vitamin A one. Here we go. Here, now we're on the right one. Okay. This is just a great paper. This is one of my favorite papers ever. Hypercalcemia and metastatic calcification. Let me see if I highlighted. I don't think I highlighted anything in here. Look at this paper, especially this introduction. As soon as they introduced vitamin D, hypercalcemia. Let's just look at common. So what I'm telling you is vitamin A causes excess calcium in the blood over time. Vitamin D supplements increase calcium in the blood over time. Copper toxicity increases calcification. All the things I fight against cause calcification. These are the symptoms of hypercalcemia, too much calcium floating around in the blood. You tell me if we see these in society anywhere. Diagnosis was often delayed because the commonest symptoms were the non-specific ones of hypercalcemia: nausea, vomiting, weight loss, colic, constipation. Gosh, is constipation out there at all these days? Thirst, frequent urination, headache, weakness, which could also be interpreted as fatigue, apathy, and depression, roughly in that order. So I'm not saying everybody's running around with high blood calcium levels, because they'll run your blood calcium. They'll be like, you're normal. Didn't we just go over in that last paper about how you could mobilize vitamin A from your liver and it goes through the blood to get to the heart, but the blood levels never changed? You can be calcifying with normal blood levels of calcium. Okay? But anyway, this great, read this intro about vitamin D, and they talk about when cod liver oil came out and all these problems started showing up. And let's go over this about, for those of you who took vitamin D supplements and now are realizing your folly, your mistake. Let me find this. So this is why it's a marathon, not a sprint. Let's see. Since the hydroxylation of vitamin D to 25-hydroxyvitamin D is not tightly controlled by negative feedback. This is doing that again. It's not highlighting. Anyway, since the hydroxylation of vitamin D to 25-hydroxyvitamin D is not tightly controlled by negative feedback, the plasma level of the hydroxylated vitamin rises with the degree of overload and may reach concentrations 10 times the upper limit of normal. It remains high until vitamin D has been reabsorbed from fat stores. Oh, you mean you can store all that extra vitamin D? The doctors, the genocidal doctors who are telling you to take these mega doses, you can store it in your fat until finally it starts coming out and flooding your system when you stop taking it? It remains high until vitamin D has been reabsorbed from fat stores, which may take several months. Consequently, the half-life of hypercalcemia, which is about 3 weeks when modest therapeutic overdose occurs, modest therapeutic overdose of vitamin D, may be more prolonged in severe vitamin D toxicity. One lady who took the Viking mixture of cod liver oil and milk, Weston Pricers, required treatment for hypercalcemia for 21 months after withdrawal of vitamin D. And another elderly lady intoxicated with ergocalciferol, that's D2, that's the prescription form of vitamin D. That's the plant-based form of vitamin D. Those of you who are eating mushrooms for your vitamin D, had elevated blood vitamin D and 25-hydroxy vitamin D levels after 17 months. 17 months. Okay? 21 months, 17 months. I usually see that with my people, what I believe that I've seen in my people based on hair tests and their calcium coming down and them being off of vitamin D supplements and cod liver oil. I had a woman, highest hair calcium level I've dealt with in a woman who stuck with me. I had one woman who was like 728 who didn't stick with me. But the woman who stuck with me, who used to do, I think she was saying she did a tablespoon of cod liver oil for 5 years, if I recall correctly. 5 years straight of a tablespoon of cod liver oil a day. Her hair calcium was 700 when she started. I wanted 40. It took 2.5 years to bring it down. So that reflects here. My experience reflects the research. I usually think now with people who don't have that bad of vitamin D toxicity stored in their fat tissues and their liver, it takes up to a year to get rid of it. So, oh wait, here, let's just go over vitamin D. Let's go over vitamin D intoxication causes an osteodystrophy, which is still poorly understood. Aches and pains in the back and around joints are common symptoms. Gosh, do you know anybody who has aches and pains in their back or joints? This gets better all the time when people get off their vitamin D supplements, just so you know. So let's get back to the vitamin A thing. Did I post this one? I think I did. We'll post it again. So here we go. Retinol-binding protein 4 promotes cardiac injury after myocardial infarction via inducing cardiomyocyte preapoptosis through an interaction with NLRP3. Wow, so this wonderful thing that escorts your vitamin A around your system is toxic itself. Weird. Maybe the whole vitamin A system is just toxic. Here we show that retinol-binding protein 4, a previously identified pro-inflammatory adipokine, was increased both in the myocardium of left anterior descending artery ligation-induced AMI, acute myocardial infarction, mouse model, and in an ischemia hypoxia-induced cardiomyocyte, that's heart muscle cell, injury model. Wow. Why would the body be trying to increase retinol-binding protein? Why would it be trying to increase that? Oh, maybe it's to bind the toxic-free retinol that's around. Here's a fun one I just like to come back to. Increased dietary intake of vitamin A promotes aortic valve calcification in vivo, in living things. In the whole animal, the whole human. Calcific aortic valve disease is a major public health problem with no effective treatment other than surgery. We fix this stuff with magnesium and avoiding vitamin D and minimizing vitamin A, stuff like that. They say there's no treatment. We previously showed, so this is a different study, we previously showed that mature heart valves calcify in response to retinoic acid treatment. Oh, they do they? Retinoic acid calcifies things. Weird. Our studies demonstrate that excess vitamin A dietary intake promotes heart valve calcification in vivo. Seems pretty straightforward to me. They were fed retinol palmitate. That's what you store in your liver. That's retinol bound to palmitic acid. This is totally a natural form. You consume palmitic acid and you consume vitamin A, and people will be like, that's a synthetic form only sold in supplements. No, you're completely wrong. You're completely misinformed. And I've shown the research here multiple times that if you take retinol palmitate that you got from some food and you take retinol palmitate that you made in a lab and you feed them to the same study animals, it will cause the exact same toxicity at the exact same intake. Joe, this is spelled right. Retinol palmitate, like palmitic acid, not palmatic acid. Yeah, so this is right. Okay. Did I post that one? Okay. Let me paste this one in there. Retinol and retinol-binding protein 4 levels and cardiometabolic disease risk. They actually say sometimes you can use retinol-binding protein. You can test RBP levels as a surrogate test for retinol levels. They're supposed to go up and down together. So you can use one to test for the other. Okay. I love this one. Remember, the scientists must protect their funding. If you're going to say vitamin A is bad, you better apologize right up front. Background: despite mechanistic studies linking retinol and retinol-binding protein 4 to the pathogenesis, the cause of disease of cardiovascular diseases and type 2 diabetes, epidemiological evidence is still conflicting. You want to know why epidemiological evidence is still conflicting? Is because they do blood tests, and blood tests for vitamin A are basically close to useless. That's why. It's not conflicting. They have the research to show. Now, for those of you, but isn't fish oil good for heart disease? But no, fish oil is toxic garbage. Throw it away. You're like, but vitamin A isn't in fish oil. Ho. Why do you think it's yellow? Why do you think fish oil is yellow and not clear then? Here, hypervitaminosis A following long-term use of high-dose fish oil supplements. Described herein is a patient who developed hypervitaminosis A, vitamin A toxicity. That means they could diagnose it in his blood. That's how bad it was. After prolonged fish oil supplement ingestion. Let's keep going. Oh, wait, sorry, hit the wrong button there. Hypercalcemia, which we were just talking about, caused by iatrogenic. Doctors, nurses, practitioners, nutritionists, dietitians in the hospital caused this. That's what iatrogenic means, caused by the health system. Hypercalcemia caused by iatrogenic hypervitaminosis A. So this guy is on enteral feeding, tube feeding. He developed asymptomatic hypercalcemia and had serum vitamin A levels several fold above normal. Subsequently, a custom-made enteral tube feeding was used, which contained negligible amounts of vitamin A. Several months later, vitamin A levels diminished substantially and serum calcium levels returned to normal. Guess we know what the cause of that high calcium was now, don't we? He would have been just fine if they never put vitamin A in the tube at all. Again, I want to emphasize the vitamin D thing. The vitamin D is garbage. Don't put vitamin D in your cake hole. Here we go. Hypercalcemia You got to see the combination here. Hypercalcemia, hypervitaminosis A, and 3-epi-25-hydroxy D3 levels after consumption of an over-the-counter vitamin D remedy, a case report. We report a case of vitamin D toxicity with hypercalcemia, acute renal failure, kidney failure. Do you remember what Grant Genereux was headed towards? He was in chronic kidney disease, which leads to acute, chronic kidney failure, acute kidney failure. Well, I mean, once it happens, it's acute, right? That's short term. Long term is chronic, right? And hypervitaminosis A after consuming an over-the-counter vitamin D supplement. What do they think caused this? The patient also displayed hypervitaminosis A unrelated to diet. Okay. Possibly caused by renal failure related to the hypercalcemia induced by vitamin D toxicity. Because of the increasing use of over-the-counter vitamin D supplements and the potential iatrogenic hypercalcemia related to hypervitaminosis A, the present case highlights the importance of evaluating both the use of non-prescribed medication and vitamin A status during vitamin D toxicity. Before I move on, I want to go to, let's see. So I want you to remember, how could taking vitamin D supplements cause or worsen vitamin A toxicity? How are those connected? Those of you who have been here a long time or long enough understand that aldehyde dehydrogenase. So vitamin A is an alcohol, as retinol. Retinol is an alcohol. Just like the ethanol that you drink, if you still drink it, if you're still duped by devil's water, if you're still drinking alcohol, ethanol, that turns into acetaldehyde and acetic acid. Retinol is the alcohol. It turns into retinaldehyde and retinoic acid. Methanol, wood alcohol, that'll make you go blind. Weird that these alcohols, that vitamin A toxicity will mess up your eyes. Methanol messes up your eyes. It's like out, and I'm sure it wouldn't take me long to go and look up ethanol alcohol causing eye problems. Okay. Alcohols and aldehydes cause eye problems. Anyway. So if vitamin A is an aldehyde, it's going to go through the same detox process that ethanol, alcohol, and methanol go through. That's the alcohol dehydrogenase system and the aldehyde dehydrogenase system, ALDH. One of the forms of vitamin A is an aldehyde, retinaldehyde. So what if we took something at high dose, vitamin D, that inhibited aldehyde dehydrogenase? It bottlenecked aldehyde dehydrogenase. So you would not make the acid after it. You would back up what's before it, aldehydes. You would not make what's after it. You would create a bottleneck. Let's just cover this real quick. I'm not going to get into the PGP stuff here. Kelsey and I will get into the PGP stuff. I'll have Kelsey on again. If you haven't seen Kelsey's special episode that we did just 3 days ago on ivermectin, go watch that one. But anyway, so here we're back to this. Inhibition of aldehyde dehydrogenase 1 by vitamin D3. And don't forget curcumin there for all you people who love curcumin. Turmeric, you think it's wonderful. No, you're slowing down your detox by taking a yellow, toxic color, bitter substance that's full of vitamin A. Curcumin is full of vitamin A. Turmeric, curcumin, full of vitamin A. I've been over how toxic they are before. Oh, actually, so Will was adding, some idiot on Twitter actually just tried to tell me that D3 supplementation fixes hypervitaminosis A. Here, let me tell you what happened one time on my Facebook. I had a gentleman message me on Facebook and say, I took too much vitamin A. I now have all the symptoms of vitamin A toxicity. What should I do? I said, you should join my program and fix yourself and not take any vitamin A anymore, because he was dosing supplements. He was mega dosing supplements. Share which article? This one? You mean this link? that one. So he poisoned himself with vitamin A supplements. I think he was a Peter, a petard, if you will. And he said, what should I do? And I said, you should avoid vitamin A and you should go in the program and read it all and fix yourself. And he comes back with a couple weeks later. He's like, no, I've decided. I'm going to take high dose vitamin D to fix this problem. Vitamin D is antagonistic to vitamin A. And so I'm going to take it. And I was like, do not do that. Don't. You're going to cause major problems. Guy came back to me, I think about a month later. Oh my God, what do I do now? Now I have all the symptoms of vitamin A toxicity and vitamin D toxicity. And I was like, how about you spend the whatever it was back then, $40 to join my program and fix yourself and stop trying to do it on your own. I wanted to be like, you moron. Like, do you think you needed some help from outside at this point? Maybe you're not just making great decisions on your own. Maybe you should get some help. And you came to me for help and you didn't listen to anything I said. So here's the thing to know, people. Vitamin A toxicity causes hypercalcemia. Vitamin D toxicity causes hypercalcemia. Do you want to know where they both get all that calcium from? Because you're like, well, vitamin A isn't calcium. How does it raise calcium? And vitamin D isn't calcium. How does it raise calcium? I can show you research that they both pull calcium out of your bones. Vitamin D does not fix your osteoporosis. Vitamin D worsens it. Vitamin D stats are only, osteoporosis stats are only getting worse. They are only getting worse. The vitamin D fad's been going for how long? 10 years? 15 years? They're pushing it even more now. Fauci loves vitamin D. You should take your vitamin D because Fauci said so. And Newsweek said so. And now there's all these studies, study after study after study after study on how wonderful vitamin D supplements are coming out rapidly. If you're here, I'm hoping you see that that's a red flag, that they're trying to convince you to take something that's not good for you. Wake up. They fought it. I want you guys to see this, that they've been whole, and you got to watch the ivermectin thing with Kelsey, especially the intro about how they got the contrarian people to take what they wanted to take, the potatoes. You'll hear that story. It'll make complete sense. So what did they do? The mainstream fought vitamin D for a long time. All the alternative people were like, this is amazing. Da, da, da. They fought vitamin D for a long time. They fought, let's say, legalizing drugs for a long time. So they create this hidden desire, the desire to have the things that you can't have. And then what are they doing now? They're unleashing the floodgates so everybody can go and make themselves sick and mentally deranged all at once. This is a brilliant plan, folks. You have to understand that this plan is from an entity that is not nice. It's like a giant puppeteer pulling strings. People don't have to be smart to do this. All a general really needs to win a war is people who follow orders and do their job. That's why when everybody's like, all these politicians are stupid and they could never do it and they're not competent enough. All they have to do is get the right instructions and do their part of the job. That's all they have to do. Isn't that how the military works? The military is not filled, and nothing against, if you're in the military and you're here, thank you for your service and all that stuff. But the military is not necessarily filled with geniuses, if you know what I mean. Okay? They need people who do their jobs. And sometimes they even try to dumb them down. They're just like, just do your job. Stop thinking and just do your job. That's all they need. Funny that the colors of vitamin A, as in red, orange, and yellow, all would be the colors of fire, hell, sulfur, brimstone. Another thing we don't like is yellow and stinks, and the smell of hell has been described as sulfur. Just weird coincidence. Coincidences. So anyway, vitamin D inhibits aldehyde dehydrogenase, which would then cause aldehydes to build up before it, one of those being retinaldehyde. That is how a vitamin D supplement could cause vitamin A toxicity. And just so you know, folks, the way they want to make the male contraceptive pill, the male birth control pill, it specifically inhibits ALDH so that you'll back up retinaldehyde. They'll say, oh, if you don't make retinoic acid, you don't make sperm. No, that's not it. If you back up aldehydes too much in the testicles, I showed the research on this. You damage the testicle cells that make the sperm with aldehydes. Got that. Okay, so next, hopefully we're going to get through the rest of these a little faster. Let's get into copper now. Another one of my favorites. Copper is a toxic metal. I'm not going to argue about anything other than that. So I might sneeze in a second. Ugh. There is something in the air. You want to hear a funny story? Some of you, if those of you who have noticed in like the last maybe 3 or 4 days, last like 3 or 4 days, I think it was Friday night, I said to my brother and my mom, I said, there is something weird in the air. It is hitting my nose. Like I can feel a tingling, almost like buzzing in my nose. If any of you out there have felt this, you can post it in the comments later. First of all, if you haven't liked the video, please like the video. X out of the chat if you're here. Awesome, you're here. X out of the chat. Go like the video. Make sure to subscribe to the channel. This is how the algos know you like it and that you should share it. But anyway, if you want to comment on this, feel free. I was just like, there's something in the air because I felt my nose start buzzing again. And my brother came back from going grocery shopping. He's like, somebody at Trader Joe's said there's something in the air. And I was like, wow. Okay, so now it's from other people. So if any of you have noticed in like the past 3 or 4 days, maybe since Friday, it's what, Monday now? If you noticed something in the air tickling your nose and all that stuff, feel free to comment. So serum copper, let's get into this. Oh, so Monica says she felt it in the air too. Yeah. So yeah, these things are not, and just because before I go into this next paper real quick, just because somebody doesn't react to something, somebody might be like looking at me and going, oh, wait, Dr. Smith, why are you reacting to this stuff? You should. Okay, let me put it to you this way. You ever seen smokers where it's like a new smoker they'll take a puff and they'll be like, oh, and they're hacking up a lung, right? Their body's rejecting it. And then you see the people who smoke a pack a day and they might cough, but they don't cough anywhere. They're like the hacking and all that stuff. They don't do that anymore. Their body has given up on that. They're too toxic to even bother. But if they quit smoking, then all of a sudden they start coughing up all this mucus. The cleaner you are, the faster your body will reject things. Does that make sense? The deeper the toxicity, the less you start rejecting it. That's why when Emily stopped eating all the vitamin A, she immediately started pushing all this stuff out. Okay. Pierre, if you know which link I missed, feel free to tell me. But let's get into this. Serum copper and the risk of cardiovascular disease death in Finnish men. I'm going to tell you, spoiler alert, the more copper in your blood, the more likely you are to die of a heart attack. Conclusion, elevated serum copper level was associated with increased risk of cardiovascular death across all BMI categories. Overweight, underweight, all of them. In middle-aged and older Finnish men. Serum copper may have prognostic implication for cardiovascular disease mortality risk. However, further studies are needed. Okay, there's one. Circulating serum copper is associated with atherosclerotic cardiovascular disease. Atherosclerotic, you mean like calcification of the arteries? Okay. Atherosclerotic cardiovascular disease, but not venous thromboembolism, a prospective cohort study. Boy, these Finnish. Conclusion, in middle-aged Finnish men, we confirmed previously reported associations between high serum copper levels and increased risk of atherosclerotic cardiovascular disease. Huh. There we go again. All you bioavailable copper people, you protocol people, you revolution people, shoving oxidized copper sulfate or whatever the heck you're taking to poison yourself, it's going to end badly. Stop sooner rather than later. Okay. Association between serum copper levels and risk of cardiovascular disease, a nested case control study in the Predimed trial. I'm going to address the sex difference here. In conclusion, in older Spanish men with high cardiovascular risk, a significant association was observed between high serum copper levels, but still within the reference values. Oh, wait. People will be like, they look at their blood test without talking to me, and they're like, but my copper's in the normal range. I'm fine. They just said high serum copper levels, but still within the reference values. And an increased risk of a first event of cardiovascular disease. Our findings suggest a sex difference in cardiovascular disease risk and serum copper levels. Hey, Dr. Smith, do I remember you saying that women seem to tolerate higher levels of copper than men? Yes, you would be remembering correctly. In my observance of people, real people, women tolerate higher copper levels before they get the same problems as men. Here, let me give you the patterns. On a hair test, men do not tolerate. So what I mean is, like on a hair test, let's say you have 100 on calcium. You have a man and a woman at 100 on calcium. I want 40. A woman will tolerate that level of calcium better than men. Okay? That's just what I've seen. Okay? Same thing with copper. If you have two higher copper levels on blood tests, the women will tolerate the higher copper better than the men will. The men will have more symptoms at that same copper level in general. Okay? Ferritin. Men will tolerate ferritin, higher ferritin, better than women. Do I know why? No. I think it probably has something to do with hormone levels. I'm going to guess copper, because women, like as an example, women are more estrogenic. Copper is an extremely estrogenic mineral. So throwing something that's really estrogenic into men will mess them up quicker. Does that make sense? Okay, hopefully it does. So this is just the research confirming what I see in practice. I don't make these things up. This is just pattern recognition. And the last one on copper, hopefully I've beaten this dead horse enough. Serum copper levels and risk of major adverse cardiovascular events, a systemic review and meta-analysis. So they're looking at a bunch of studies together. That's why this one's the last one. Conclusion, high serum copper levels were associated with an increased risk of total stroke, myocardial infarction, heart attack, and cardiovascular mortality, death from heart disease. Hybrid studies seem to modify the strength of the association between serum copper and the risk of cardiovascular mortality and ischemic stroke. Okay, so copper. Now let's get into zinc. So what do we want with zinc? Let me tell you something here. Can you overdose on zinc? Yes. Do I think that it's taking too much? When people say, well, if you take too much zinc, you're going to deplete your copper. No, I don't think it's that. I think it's that people just took too much zinc. Okay, you guys, Karen is having issues. Those of you in the Love Your Liver, I mean, Karen, you can always go to Karen's having trouble figuring out what to eat now. So those of you who want to help Karen in the comments with the basics of the Love Your Liver dietary approach, feel free to help her. Karen, I'm going to give you one suggestion. Those of you who start doing this, do not take every single other thing you've read on the internet about what not to eat and combine it with what we do. Don't do that. You'll end up with nothing to eat. Starvation is a sure way to sickness and death. Don't do that to yourself. If we're saying it's generally okay and you feel okay eating it within our framework, then eat it. Doesn't matter what other people on the internet say. Other people on the internet will be like, iron is terrible. Well, you want to know what increases iron absorption? Vitamin A. You want to know where iron problems come from? Vitamin A toxicity. So some people would say, don't eat red meat. Well, how about all you folks here in the Love Your Liver program who, do we follow the don't eat red meat thing? No. Do we fix high ferritin all the time? No. So, yes, please help Karen with finding some things you can eat. Generally, I'll just go over it real quick here. Meats. Specifically, red meats like beef, bison, lamb, goat, if you're into it, red meats. Poultry. Generally in the US, you're going to be looking at chicken and turkey and wasn't there one other one? I don't know. If you're into duck or whatever, I don't know. Chicken and turkey. That's basically it. Okay? Then you're going to be looking at things like, if you tolerate them, you're going to be looking at things like grains, whole grains. You're going to be looking at, I'm not going into the details here. So anybody here who wants to do the fine tuning and stuff, I'm not doing that right now. Beans that you tolerate. There are some low vitamin A vegetables out there. The fruit list is pretty short. If you want the best ones, you're looking at bananas, you're looking at apples, you're looking at green grapes. If you have to do eggs, you're looking at egg whites, not the yolks. Just ignore the egg cells. They know not what they do. Did I miss anything? Here's what you drink. Water. Some people get into dandelion root tea. I haven't seen that necessary at all, and I'm not sure that that's productive in the long term. Yeah, some people are just putting their list of what they eat in there. So, yeah. Oh, there's Joe's list. Okay, so yeah, you guys got her taken care of. So, Karen, anybody who's watching this wondering what to eat, you can go in the chat, look at that, and get started feeling better. And just so you know, if you're new out there, Karen, or you're introducing this stuff and what to do, here's the first foods. Think of it as, I mean, you do need to have foods to eat, right? There is, oh yeah, Pierre posted about, think of how cowboys eat beans, bread, and meat. Yes, we do have people who do the cowboy diet. They just eat beef and beans and they get better. All these people are like, but what about the nutrients? And it's like, apparently the cowboys kind of like built most of the country. You know, they were like building the country as they went across. And they worked all day, harder than you and I will ever work. They probably did more in a day than you and I do in a week. And they were eating like beef and beans, and they got some bread, and once in a while they'd get like some probably terrible canned vegetables. They were on a low vitamin A diet. Also, the biblical diet is generally low vitamin A. People will say, oh, but there's dairy in there. And I'm like, if you think they got a lot of dairy 2,000 years ago, I'm sorry, your version of history might be a little off. If you think they got a lot of honey, no, yes, honey and dairy existed, but they didn't get much of it. Okay. I think I even did a live stream about the foods of the Bible, didn't I? I think. So let's go into zinc then. Zinc is very important. Just so you know, like red meat is about 10 times higher in zinc than poultry is, ish. So if you want to get your zinc from foods, the only way you have a chance is to eat some red meat or to supplement. Poultry's not going to do it for you. Okay, this is how important zinc is. For like the protocol people out there thinking that supplemental zinc is the most terrible thing you could ever take. Well, it's actually what I include in nearly everybody's program to help get them better, as long as they tolerate it. If you don't tolerate zinc, even at super small doses, don't take it yet. You're not ready yet. It's as simple as that. I'm not ready for calculus yet. Well, then go back to algebra. Figure out algebra first before you move on to the next level. You're not there yet. This is such a difficult concept for everybody because everybody wants people to have the same solution for their health. No. This is why we're able to get people better with hugely different presentations. We have people who can take tons of zinc. We have people who can't take even 2 milligrams of zinc. This is why we don't do a protocol. Protocols are for people who don't think. This is why my supplements are not big combinations of things. They're one piece generally at a time. Yes, Keystone Minerals has 3 things in it, but that was kind of made for convenience for people who wanted it. If you listen to your body and you listen to the advice in the Love Your Liver program, or if you work with me individually, you can figure out what works for you, and it's going to be different than just about everybody else. And that's okay. That is true medicine. As in one man's medicine is another man's poison, that saying, right? It's not that far apart. But it could be like right now you don't take zinc and this other person is taking 60 milligrams of zinc. That's it. So zinc, here's this paper, Zinc and Cardiovascular Disease. I'm probably going to go over noon. So those of you who are here for the from the inner circle, I'm probably going to go over. Oh, I am at noon. I'm already there. We're only at zinc. Zinc is a vital element in maintaining the normal structure and physiology of cells. Sounds important. The fact that it has an important role in states of cardiovascular diseases has been studied and described by several research groups. It appears to have protective effects in coronary artery disease and cardiomyopathy. Intracellular zinc plays a critical role in the redox signaling pathway, whereby certain triggers such as ischemia, that's lack of oxygen, or that's lack of blood flow, right? I'm brain farting right now. Ischemia it's like a blockage of the blood flow so you don't get oxygen, right? Anyway, an infarction, that's a heart attack, lead to the release of zinc from proteins and cause myocardial damage. I want you to listen to that because there's some papers out there. People are going to look at them and be like, I saw this paper that said that increased zinc ions was bad for the heart. Okay, there's papers out there. I'm not going to go over them because they're going to confuse you more, but I'm going to give it to you right here. Certain triggers so this is tissue damage, such as ischemia and infarction, lead to the release of zinc in protein. So it was already there and cause myocardial heart muscle damage. Key factor here. In such states, replenishing with zinc has been shown to improve cardiac function and prevent further damage. So they're damaging cells. Their zinc is coming out of these cells. But when they gave them more zinc, it fixed the problem. So was the problem too much zinc? No, it wasn't. It was something else. You know that zinc protects you from vitamin A toxicity and zinc protects you from copper toxicity. So let's just keep going. The relationship between serum zinc levels, I'm going to try to do these fast now. The relationship between serum zinc levels, cardiac markers, and the risk of acute myocardial infarction by zinc quartiles. So they divided people up. They divided all their people into 4 groups, quartiles. Okay. Conclusions. The present study revealed a relationship between serum zinc levels in that zinc levels were significantly inversely correlated with serum creatine kinase MB, and cardiac troponin T levels. So what they're saying is more zinc, lower heart disease markers. More inverse, more zinc, lower heart disease markers. Or you could say high zinc, lower heart disease markers, okay? Furthermore, we found that the prevalence rate of acute myocardial infarction decreased with increasing zinc quartile. So as each group, as you had higher levels of zinc, the risk of heart attack went down. We're starting off well, right? Next paper. I hope I put that link there. Yeah, I did. It looks like I did. The relationship between serum zinc level and heart failure, a meta-analysis. Overall, the pooled analysis indicated that patients with heart failure had lower zinc levels than the control subjects. Further subgroup analysis stratified by different geographic locations also showed that heart failure patients had lower zinc levels than the control subjects. In addition, subgroup analysis stratified by heart failure subgroups found that patients with idiopathic dilated cardiomyopathy had lower zinc levels than the control subjects, except for patients with ischemic cardiomyopathy. Okay. Associations between copper and zinc intakes from diet and mortality from cardiovascular disease in a large population-based prospective cohort study. Did I put this one up? Yes, I did. Oh, you copper lovers are going to hate this one. In conclusion, dietary copper intake was positively associated with mortality from cardiovascular disease in both genders. The more copper they got from food, the more heart disease they had. The more copper they ate from food, the more cardiovascular disease they had. Now imagine you guys taking that blue copper oxidized blue copper sulfate. Sulfate slows your detox systems. Copper damages everything it touches. Oh, higher dietary zinc intake was inversely associated with mortality from cardiovascular disease or coronary heart disease. Coronary heart disease, yes, right there. In men, but not women. Okay. Inversely related. More zinc, less coronary heart disease. I'll take it. Serum, was this the same one? This one's a little more confusing. It's a little more technical in the part I'm going to read. I'll try to get through it fast, but also help you to follow it. By univariate analysis, log high sensitivity C-reactive protein. This is an inflammatory marker. High sensitivity C-reactive protein. The more of it you have, the more inflammatory they're saying you are. Okay. And non-HDL cholesterol. That would be like LDL cholesterol, VLDL cholesterol, what they call the bad cholesterol. So they're saying this inflammatory marker and non-HDL cholesterols. Why did they group it like that? Because they think those are the bad cholesterols. So inflammatory marker, CRP, bad cholesterols were associated with serum copper concentrations. What they're saying there is as your copper went up, the inflammation marker and your bad cholesterols went up. Okay. An independent predictor of your copper levels was high sensitivity C-reactive protein. They're saying they could kind of tell what your copper level was by your high sensitivity C-reactive protein, an inflammatory marker. Serum zinc concentrations decreased with age. You want to know what else increases with age generally? Toxicity. Toxicity depletes your nutrients. Serum zinc decreased with age. After adjustment for age, serum albumin, HDL cholesterol, and red blood cell were positively associated with, and serum insulin and log hsCRP were inversely associated with serum zinc. So, serum zinc, inverse. More serum zinc, lower insulin. Ooh, that's good. More zinc, lower CRP. Ooh, that's good. They're saying more serum zinc, higher HDL, the good cholesterol. Cholesterol is a huge topic that I'm not getting into right now. That's basically, yeah, they're saying HDL cholesterol was associated with serum zinc. So more serum zinc, more of the good cholesterol. Sounds like zinc is good. Zinc and copper levels in severe heart failure and the effects of atrial fibrillation on the zinc and copper status. In patients with advanced congestive heart failure, right? That's what they're saying CHF is here, right? Congestive heart failure. Irrespective of the type of rhythm, irrespective of the pattern, profound hypozincemia, that's low zinc in the blood, profound hypozincemia, and a decreased zinc to copper ratio were present. So a decreased copper to zinc ratio means more copper to less zinc. Profound zinc deficiency and more copper relative to zinc. Okay. We're going to hit selenium real quick. Selenium is another important one that we use often. And I'm going to tell you that the zinc in the soil, or the selenium in the soil, is decreasing rapidly. Even the Brazil nuts that used to work to raise people's selenium, it's not working anymore. Serum selenium concentration was determined in 49 patients with acute myocardial infarction within 4 hours after the beginning of the symptoms. Wow, they're really getting that test done quick, aren't they? The mean serum selenium concentration of the patients was significantly lower than that of healthy controls. Among the 49 patients with acute myocardial infarction, heart attacks, 41% had serum selenium concentration below the 95th percentile of the healthy control group. It is concluded that the low serum selenium concentration was present in these patients before the acute event, and it was not a consequence of the myocardial infarction heart attack. Okay, let's keep going. The impact of selenium deficiency on cardiovascular function. Selenium deficiency was first associated with Keshan's disease, an endemic disease characterized by cardiomyopathy and heart failure. Since then, selenium deficiency has been associated with multiple cardiovascular diseases, including myocardial infarction, heart failure, coronary heart disease, and atherosclerosis. Seems important. Selenium and its supplementation in cardiovascular disease. What do we know? I put this in here because I'm not going to blow smoke up your butt and say just take mega doses of zinc and take mega doses of selenium. That's not what I do, because I actually have ethics and morals, and you can have too much of a good thing, right? You can here's the key thing that's the difference. When people will be like, "Oh, but it's the dose makes the poison." That's the dose makes the poison is a garbage saying put on you by the pharmaceutical companies so they can say, well, if you just take a small enough dose of our poison, it won't poison you. The dose makes the poison is intended to turn off your brain. Can you drink so much water that you can kill yourself? Yes. Do you need water to live? Yes. Okay. Could you take so much turmeric you could kill yourself? Yes. Do you need turmeric to live? No. So what does that make it? It makes it a poison. If you don't need something to live, but too much of it can kill you, that only leaves it as one thing, folks. Right? So, key difference here is you need selenium to live. You need zinc to live. Can you overdo them? Yes. Nobody's here is arguing that you can't overdo them. Why do you think I test people? Why do you think I test for like zinc? I test hair and blood. Because I don't want to overdo it on people. Have I had people who come into the Love Your Liver program, especially typically men, who are like, I'm just going to hit it hard. And they take too much zinc and they get 100 milligrams or more. And maybe at the start they feel better. And later I tell them like, you get up around 100 milligrams a day and it's going to bite you in the ass. And then later we get these same men commenting in the Love Your Liver program like, don't do what I did. And I'm like, I already told you, don't. So but where dysregulation, what are they saying about dysregulation? Don't take too much selenium. Selenium can be toxic, of course. I run into deficiency a lot more than I do toxicity. Selenium toxicity symptoms, just if you were ever taking it and you wanted to know what they might be, the most common ones can be joint pains, like usually it's multiple joint pains, or nervy type things like the tingling, burning, buzzing, whatever. Or this is the crazy one. Too much selenium. This is documented in, I think, a medical book around the early 1900s. One of the Love Your Liver program people found it. It is intrusive sexual thoughts. Like you cannot stop your brain from thinking about sex. Like it's messing up your quality of life. You can't stop thinking about sex so much. Now, if somebody's had no libido, might they be deficient in selenium? Quite possibly, but that doesn't mean don't go and do what somebody I know did, which was take tons and tons of zinc because they wanted to boost their libido by taking extra zinc. They caused themselves problems later with zinc toxicity. So let's not be dumb. Yes, you can cause toxicity with anything. But if it's essential to life, you need it. Vitamin A is not essential, folks. We've proven this. We've gotten people's blood zinc level, or blood vitamin. I say that wrong. We do not need vitamin A. We have gotten people's vitamin A levels in their blood nearly down to zero. And they don't have any of the problems, supposedly, with vitamin A deficiency. And the only way you get people's vitamin A levels in the blood down to zero is by doing a long time of very low vitamin A in the diet. And they're fine. There's only two supposed symptoms of supposedly truly connected vitamin A deficiency symptoms, and that's night blindness. And what's the other one? Oh, the scraping of the scraping of the surface of the eye, the keratomalacia, something like that. That's the term. We don't have any of those in our people. Yeah. Zen Dog Breath asks, so is it not a good idea to let high school boys use Selsun Blue for their dandruff? Okay. Let me just go. Zinc deficiency is everywhere. Selenium deficiency is everywhere. Head and Shoulders is the old school Head and Shoulders formula is a zinc formula. They now have Head and Shoulders that is the clinical strength, which is a selenium formula. Selsun Blue is selenium. What they are doing when you use Head and Shoulders, I'm expanding on this, Zen. When you use dandruff shampoos that are selenium or zinc on your head, you are supplementing the skin cells, your scalp cells, with selenium or zinc. You're absorbing that into the tissue, and it's helping to change it. If the cells on the outside of your body are deficient in zinc or selenium, how do you think they got deficient in the first place? It's probably because your diet didn't have enough zinc or selenium, or your diet was toxic in things that counteract zinc and selenium. Like, I don't know, copper and vitamin A. So That was a very important realization for me about when I was like 16 and I had dandruff. And they told me, use Head and Shoulders or use Selsun Blue or whatever. And then I also had tinea versicolor on my chest, which is a fungus. And one of the things the dermatologist told me, he's like, you could just put like Head and Shoulders or Selsun Blue on your chest. I think he said Selsun Blue. Just put it on your chest, smear it on your chest when you're not in the shower. Just leave it on there for like half an hour and then go wash it off. And this was where my brain turned on and I went, wait, the active ingredient in this is selenium. I'm supposed to get that from food. Why am I putting it on my skin? And then I had the realization, maybe I'm deficient in selenium because that's what my cells are built of. And I knew skin cells move up towards the surface, right? You got lower levels of skin cells that aren't at the surface, and then each cell comes up, kind of like shark teeth where they rotate to the front, they fall out, and then they bring new ones forward. Your skin cells, you bring new layers up. I was like, well, why don't I just fill up the lower levels with selenium? Wouldn't that help my tinea versicolor that is helped with topical selenium go away? And lo and behold, it worked. It doesn't always work. It could be a zinc deficiency. It could be a selenium deficiency. Why do you think they make both of the dandruff shampoos? And why does sometimes one work for somebody and the other one doesn't, and vice versa? Because it might be one or the other minerals. Anyway, so moving on. There's selenium, vitamin A. Oh, I'm just going to hit a couple ones just real quick. Magnesium and potassium. We do a lot of topical magnesium on the program. Topical magnesium, in my opinion, topical magnesium chloride, not magnesium sulfate, not Epsom salts. We do not use those. Sulfur slows down the detox system. I'm just going to hit on two big ones. I'm not going to go into tons of detail on these papers. I actually specifically got meta-analyses, so we looked at a bunch of studies at once. Magnesium and the risk of cardiovascular events, a meta-analysis of prospective cohort studies. Conclusions, significance. There is a statistically significant nonlinear inverse association between dietary magnesium intake and total cardiovascular events risk. Eat more magnesium, less heart disease. Serum magnesium concentrations are linearly and inversely associated with the risk of total cardiovascular disease events. So more magnesium in your blood, less heart disease. So they found it in the diet. They found more magnesium in the diet, less heart disease, and more magnesium in your blood, less heart disease. Huh. And then people will be like, but this hasn't been proven. And I'm like, dude, keep waiting. You go keep waiting. I'm going to take this information that I have seen in the research, and I have seen it in live people work. I'm going to progress and go help people. If the world was run by scientists, nothing would ever happen, because scientists just are... We need more studies. We need more research. We need more studies. We need more research. That's not proven, da-da-da-da. Whereas real people out in the real world, like I'm taking this and making educated approaches. Anthony Mawson is an amazing researcher. And he would still, when I'd talk to him, I'd be like, well, this is what I'm doing with people. And he'd be like, well, that's still not proven. And I was like, okay, dude, I'm running. I'm off. Dietary magnesium intake and the risk of cardiovascular disease, type 2 diabetes, and all-cause mortality, a dose-response meta-analysis of prospective cohort studies. I have a whole video on this channel showing the one study I can find that shows vitamin A, or two studies, I think it is, vitamin A depletes magnesium. Weird coincidence, right? Conclusion, increasing dietary magnesium intake is associated with a reduced risk of stroke, heart failure, diabetes, and all-cause mortality. All-cause mortality. Now, moving on to potassium. Again, I just wanted to hit these. I almost forgot about doing these, but do we talk a lot about magnesium and potassium on the program? All of your liver people should be like in unison and go, yes. Potassium intake, stroke, and cardiovascular disease, a meta-analysis of prospective studies. Conclusions, higher dietary potassium intake is associated with lower rates of stroke and might also reduce the risk of coronary heart disease and total cardiovascular disease. These results support recommendations for higher consumption of potassium-rich foods to prevent vascular diseases. Copper depletes potassium. Vitamin A blocks potassium channels. Vitamin D supplements deplete potassium. When you have those things depleting your potassium and getting in the way of your potassium, getting more from foods can help you. Yeah, Monica says, yes, I emphasize potassium and magnesium. Zendog Breath says, yes, I emphasize potassium and magnesium. Last one, effects of increased potassium intake. So they increased it. Effects of increased potassium intake on cardiovascular risk factors and disease, systematic review, and meta-analysis. Highlight anything? There we go. Conclusions. High quality evidence shows that increased potassium intake reduces blood pressure in people with hypertension and has no adverse effect on blood lipid concentrations, catecholamine concentrations, or renal function in adult. Higher potassium intake was associated with a 24% lower risk of stroke. Moderate quality evidence. Okay, so pretty sure that's all of it. So we're at 12:24. I am sorry, folks. I'm going to have to take the. So we still have. We're gonna have to roll over, Joe. If we can roll over that super chat. I think Ramon had a super chat. If anybody else had super chats, I missed them completely because I was just on a roll. Those of you who who are here and enjoyed this, remember, again, leave a like. Make sure to comment. Yeah, Mikey, I have to go too. I got to go do another 1.5 to 2 hours of live stream for the Inner Circle folks inside the network. So I'm going to wrap it up there. So Joe, if you could just get any of the super chats and we'll keep those. We'll roll those over to next week. Oh, Joe's asking if somebody else could do it. Hope, could you, if you're still here, Hope or Will, could you just get any super chats and copy and paste them out? That'd be great. And just email them to me or message me. That'd be awesome. And you can't see them. Oh, am I gonna have to go find them before we go? I think I only saw one. I only saw Ramon, I think. They're colored. I think it was green. Anyway, I don't want to leave without the super chats. Oh my goodness. How many chats did we have during this whole thing? You guys are really like rocking the chat. I have so much engagement in my chat. Okay. So, okay. For Ryan Patrick, Ryan, I'm just going to answer this right now. What's up, Doc? What are good sources of iodine? We are here fixing people's thyroid problems without ever discussing iodine. The best sources of iodine, I put giant quotes around that. The best sources of iodine are seaweeds, which are super high in vitamin A, and dairy. We don't use those. I have a whole article here. Let me find it. Vitamin A messes up iodine metabolism really bad. I'm going to put this link in the... We don't worry about iodine from food. Now, there are places in the world that have really endemic... really endemic, like as in it's normally there, like Pakistan. I've had Pakistani clients who have really low iodine, and all they did was they added, this is not what I generally suggest, but they added enough iodized salt to get the RDA of iodine. I want you to listen to this. They added iodized salt to get the RDA of iodine. The RDA, that's it. People be like, the RDA is not enough. Anyway, they got the RDA of iodine. And all of their iodine problems went away. And then they were able to quit the salt and they didn't have to bring it back in. the RDA of iodine for, I don't know, from table salt for a month or two, fixed their iodine problems and they didn't come back. You people out there who are high dosing, mega dosing iodine, particularly potassium iodide, you're ruining your thyroid. And if you haven't seen my article on that, that's something. So I don't worry about, why this thing jumps around. Did anybody find any other, did I seriously not, Pierre? Oh, is that Will? Did you from Eve? Okay, Will posted. Okay, Eve posted on low vitamin A for 6 weeks and lots of locked up muscles, stiff neck. Magnesium and potassium aren't touching it. Could this just be from the low vitamin A diet? I'm doing the same soluble diet as before low VA, but maybe I'm more sensitive to it. You want to calm down on whatever you're doing. I do. You're. So remember, you may want to talk to Emily. Emily posted her Twitter account, Mish Fish or something like that. And you know, if you're not in the Love Your Liver program, Eve, if you are, great, you can post your questions there, and people there may have suggestions for you. Now, one of the things about a stiff neck, those of you who know Chinese medicine, acupuncture points, what meridians run right up the backside of both sides of the back of your neck? It's the gallbladder meridian. Gosh, is your gallbladder connected to your liver, basically? Yes. So if you are dumping bile, if you are pushing things too hard, first of all, that's just going to be, it's not vitamin A deficiency that's going on here. It's probably, I mean, you're saying you're doing magnesium and potassium. I don't have time here to do the troubleshooting that I do in like my office hours for other people, but you could just be pushing things too hard. You may want to, definitely calm down on anything agitator wise, stress, heat, sweating, exercise, those kind of things. And then you might be on too much soluble fiber, pushing things too hard right now. If you're not getting along with the magnesium or the potassium, that's always something that can happen. You could be using the wrong magnesium or the wrong potassium chloride can react negatively in some people. Any type of gluconate, glycinate, any of the potassiums that are supplements can have negative responses in people. Could be a zinc deficiency that's being exposed. Could be too much zinc. This is why people hire me for testing and consultation, is so we can, I hash all this stuff out in the office hours when I have people in those groups. So I don't have a lot for you. You may want to talk to Emily and maybe Hope and see about their experiences early on. And if you're in the Love Your Liver program, you can lean on the entire, like the 2,000 people that are in there. Okay, Trusty Rusty was asking about what about a high anion gap with, I forget if it was vitamin K or I'm sorry, potassium or not. What might cause high anion gap with K? I have no idea. I don't do it. I don't use it. It would be, so the way I would look at that, I wish I had a good answer for you, but what could cause it? My Google would be as good as yours. I don't have an answer for that. I ditched so the high anion gap would be a symptom of something else, right? As you're saying, what would cause it? I would be looking at essential minerals as we go by them, which is there's very few that we worry about. And I'd be looking at, liver stuff. But this liver stuff, I don't need to know people's liver enzymes to help them fix their liver. The liver enzymes just show us a symptom of what's going on, just like kidney labs show us a symptom of what's going on. Most labs that your doctors are running are showing you symptoms of what's going on. Like if you say, I have high blood sugar and that's the cause of my diabetes. No, you'd go, why do you have high blood sugar? That's a cause of that's a symptom of something else. Why do you have low testosterone? That's a symptom of something else. Why do you have low red blood cells? It's a symptom of something else. So that this with why do you have a high anion gap with K? I have no idea because I don't even look at that lab. I wouldn't even know what to do with it. That's not something I memorized. And it would still be symptoms. I mean, here, you know what? I'll do it. Let's just see high anion gap causes. See if I can find a one that I like. Approach to patients with high anion gap metabolic acidosis. I don't know if that's what you said you had. This is just not going to be very productive. Like I said, your Google is as good as mine. I would be looking into potassium problems. I'd be looking into magnesium deficiency. I'd be looking into, all the other things that I go over. But yeah, I don't have. Like I said, your Google's as good as mine. And for those of you who don't know this, a lot of your doctors, when you go in there to ask them about problems, they'll go and Google it. So just because I'm doing it live on a live stream doesn't mean that, I figured all this stuff out. You can always go to the doctors who memorized all their stuff in medical school and you can be like, wow, they spit it out like this. Whereas I go and I research it and I'm like, yeah, that connects with what I have found. We get into the causes. So I wish I had a good answer for you. Eve, yeah, could it be from the low vitamin A diet? You have to understand could it be from the low vitamin A diet? Well, it's not because you're on low vitamin A, so imagine this. Could it be from the low vitamin A diet? If you have an alcoholic, I'm not saying you're an alcoholic. I'm saying if you have an alcoholic, retinol is an alcohol. So if you have, maybe you were a retinolic before. You see what I mean? So if you were a retinolic, like Emily was a retinolic before. If you have a true alcoholic and you take away their alcohol, do they feel better right away or do they feel worse? They feel much worse. It's called withdrawals. Like you have a bad enough alcoholic and you just suddenly take away alcohol, they could die. They could actually die from you taking away the poison. So, is it possible that, and actually what I believe that those people are doing, when you take away the alcohol from an alcoholic, they are finally dumping all that toxicity that was stored in their liver via the bile. And then they get all these symptoms. Because what else? It doesn't make any sense. There's no other explanation. What are the withdrawals? See, it all starts when you think about toxic bile theory. It all starts to make sense. You go, they weren't detoxing, so you have to stop intoxing so you can really get started detoxing. While you're putting the poison in, you can't detox. Like the alcoholic, they're drinking alcohol, they're putting poison in constantly. They're not detoxing. They're not detoxing anything well, so they're just storing it all up. And then when you stop putting the poison in, like a lot of people will do this with the vitamin A detox, like you're saying, and possibly if Emily wants to chime in with this, if she's still there, that you stop putting the poison in and maybe you feel better you feel significantly better. You notice a big shift, improvement for a couple days. And then all of a sudden, wham, you start making bile and dumping bile. And you're still leaking it because you're not fixed yet. And you feel terrible because you're finally dumping bile. And that bile is stored up toxicity in you. And it's still leaking into your system. Trusty Rusty says we're in Retinolics Anonymous. Yes. We could, we'll change the name of the live stream. Retinolics Anonymous. But that's the idea is, yes, you can have a negative reaction to it. Now, if people are deficient in things, like a lot of the people who out there who like to speak poorly of my work, they don't seem to realize that if, like, let's say people are doing a low vitamin, let's say they come to this process and they're not following my work. Let's just say they're following Grant Generou's, beef and bison, black beans, and white or brown rice diet. And they came to the process zinc deficient. They were already zinc deficient. I see it all the time. Nearly everybody who comes to me is zinc deficient. So why would those people be any different? They'd be zinc deficient. And let's say that the amount of meat that they're eating, you have to remember, you stop eating vitamin A, and the copper intake is generally lowered with that type of diet. The detox increases zinc needs. So imagine this, you have your daily zinc needs, just for maintenance. You have the increased needs of the detox, and you came to it deficient. And yet you're one of these people out there who is like, I believe that we should get everything from food, irregardless. Yeah, okay. If you're deficient and you're detoxing when you come to this, there's no way in hell you're going to catch up. No way. But you've set your sights on what you will do and what you won't. Okay. I mean, there's a certain strength in that. If you, as Coach Tony Blauer says, he says, be careful of practicing the wrong thing. You just might get really good at it. If you made the wrong choice of, you're like, I won't supplement, and that's the only thing that's going to fix you, it may take, or you could do it for years and maybe you get past all the toxicity, suffering the whole way because all you needed was some extra zinc, but you suffered the whole way. And then by the time you get to year 5, you're detoxed and you don't need the extra zinc more than your food could give you. So maybe your food could give it to you in year 5 or 7 or whatever. I mean, Grant was eating up to 2 pounds of meat a day and he still felt benefit from taking a zinc pill in his early days of the vitamin A detox. If he felt benefit from a zinc pill, it means he was deficient. And he was eating 2 pounds of meat a day. So you ladies who are eating like a half a pound or a pound, you might never get there. And you're full of copper from your birth control and your past vegan, vegetarian diet debacles. So just that's where I would definitely, Eve, I would, the $99 to get into the Love Your Liver program and ask these questions on the main space, the main home space, would be really valuable. You might get some really good insights on what's going on. You could just be pushing things too fast. You may just be really dumping real hard. That we can't make go away. Grant wants to make it so that the detox setback, as he calls it, these detox dumps never happen. I don't think that that's possible. There's going to be times where, it's like when you start exercising. Do you get sore when you start exercising? Yeah. How many weeks can that last? Oh, multiple weeks. And then if you push too hard in the gym, can you be even more sore again? Yeah, you can be sore again. It's usually never as bad as the first time, right? So this happens, I hope that got... Karen says, my mind has been blown since Friday night, unlearning everything I was taught growing up. That's what we're doing here. We are only after the truth. We are only after the truth. Oh yeah. And here we go. This is what I'm going to end on. Trusty Rusty says, I absolutely love how every week Dr. Smith starts wrapping up, but ends up staying 20 minutes more. I have a problem. I want to help people and I can't stop. I'm an educator. Like my first website was drsteacher.com. That is one of the naturopathic principles that I took the most to heart. So yeah. And then he says it's a meme at this point. Yes, you can just meme me staying on too long. So now I'm going to wrap it up. All my links are below, nutritiondetective.com. The Love Your Liver program's at members.nutritiondetective.com. All of it's down there. Follow me on social media, like and subscribe and all that stuff. And I will see you all next week. Hopefully, Kelsey and I will get together and we'll figure out a new topic. We'll go over PGP inhibitors and all this, the chloroquines and all that stuff. So anyway, have a great week. I'm really wrapping it up now.